I think from a prevention point of view, there's the standard perspective of infection control and prevention. I think that's the one that most people are focused on. It's really positive to see that a lot of other people are considering things like mental health and also about the ability to thrive and really achieve.
So, for example, we have a number of workers who are over 70 years of age, so they were considered to be high risk, so we had to look at how we were going to manage them. And then if we had workers who were had some non-work related illness that they were managing, so if they were on immunosuppressants or the like and would maybe have been at high risk, so we had to look at how we were going to manage them. So we put out directions and advice on how to do that. The other critical thing for us, and what's been talked about, of course, in the media a lot, is the management of the supply chain, so that we could have maintenance of our PPE supplies. That's been very challenging. Obviously, a lot of PPE comes out of China, so that was problematic for us.
I think there's a pretty strong focus on business continuity, and by broadly, by definition, our role as part of that is to reduce harm, but also support businesses either continuing to function as if you're running essential services, or secondary if you aren't, how to then reduce those activities of your business and cause the least amount of harm.
And we will be looking at mental health in that sector. We are looking at how we can manage people post-pandemic. We do have some concerns that there might be some post-traumatic stress disorders that we might see, and we are looking at how we can manage those, and we're looking at developing some champions in the workplace, so to upskill some of our workers with some skills in recognising stress in their colleagues. But I would say, if my advice to any other business who are still looking at what they can do, the biggest thing is around good, clear, concise communication, and at a level of what your people can understand.
I think there's a degree of complacency potentially that can creep in, and so that if when we do open borders and travel commences, there potentially then is the increased risk of then either a second or third wave coming through. So I think at the moment, as the shift from infection prevention and control and more towards things like mental health, but also implementation and use of the biopsychosocial model in assessment of risks, and also management of sort of how to create conditions where we can actually get people to thrive in this sort of agile new normal of post-COVID-19. But I think that's really going to take a bit more thought, but it has to be industry specific.